Welcome, everybody. This is a very exciting night. We are debuting our workshop series with the Vestibular Disorders Association with one of the best I can think of. I want you guys to, as mentioned in the comments, find a nice, comfy, quiet place and get ready for this amazing workshop series that we have for you tonight. Tonight, we'll be covering a topic on grounding, which I'm going to allow our guest to introduce, but let me first introduce her. We are joined by a familiar face, Dr. Kathleen Stross, who is a holistic physical therapist and wellness coach, as well as one of the premier vestibular and neurological physical therapists in the country. Her physical therapy career back in 1989 and quickly focused on the treatment of the severely neurologically impaired. She developed one of the first vestibular rehabilitation programs in the U.S. and develops treatment techniques for those with dizziness and balance disorders. Her neurosensory approach to physical dysfunction allows an appreciation for the nervous system's role in processing every stimulus and orchestrating all expression. She's known to many of her peers and patients as the dizzy guru, and her lifelong commitment to dizzy patients is demonstrated by her service on the board of directors and serving as the current president of the Vestibular Disorders Association. Welcome, Kathleen.
Thank you. It's so great to bring a session like this today. We've enjoyed this regular time with the vestibular community worldwide each month. It's been so fun to be with you, Dr. Tolman. And you know, I know that you have a bag of tricks and skills up your sleeve too. So I hope we hear from you now that we've shifted to these workshops. So welcome, everybody. We are trying to bring you in the vestibular community tips and tricks and tools that you can use to start feeling better soon. And one of the best ways to do that is to get in touch with our nervous system. And today I'm going to be talking to you about a form of symptom management that is portable, requires no subscription or piece of equipment, doesn't even require an insurance deductible. You can do it alone, anywhere and everywhere, and it's discreet. So this is something that for 30 years I have found really has separated me from other vestibular therapists in the early days. But I believe now that people are more aware of the whole body being involved in vestibular symptoms, that they're being more open to this idea of a neurosensory grounding technique. The techniques I'll be covering today can be called many things. They can be called surface orientation. That's what we used to call it. They can be called grounding, although the word grounding can mean something different that really involves even putting your hands and feet on the earth. And I'll talk a little bit about that in a second, but that's not what we're doing today. So if you're sitting outside and you've cupped a tent in the backyard and you're ready barefooted, lying on the ground, you'll have to come back next time when we'll get outside. But today, the word grounding we're using just refers to the fact that we're grounding and connecting with the earth using gravity, but not quite in that, rugged environmental sense today. It also can be called Somato sensory orientation. The word somato means body, and so body sensation, orienting to that is another name for it, somatosensory orientation. It can be also called sensory awareness or breathing exercises and relaxation. Now, the research is full of evidence that vestibular rehab programs often involve relaxation and breathing as a part of that holistic approach. Anytime we're dealing with the nervous system and symptoms of dizziness, lightheadedness, vertigo, imbalance, it's important that as we retrain the nervous system, we get people out of a fight, flight, or freeze position where you hold your breath, you raise your shoulders, you lift yourself off the chair in fear, anxiety, confusion, and all the things that go with that, and relax into the surface with an exhale, a breath, and grounding.
We see that a lot in our patient population, right? I mean, those with vertigo and symptoms of imbalance just, have that heightened anxiety because it's normal to be worried about how they're feeling and what they're going through. So we're already dealing with a heightened sense of these sensations. But I want to go back to what you said about the somatosensory system. that is one of the three main balance systems in our body. So it's not just about, trying to, get in touch with ourselves and feel ourselves. There's a lot of hard-based evidence about this and how it contributes to our entire balance system, where it's the vestibular system or the inner ear, the somatosensory system, and our vision, and how they all tie together. Sometimes we're relying too much on one thing or the other, and we have to learn to re-weight those systems. So, this idea of grounding or somatosensory reorganization is huge, and something that we learned a lot about when we took that Emory course for vestibular certification. Dr. Janine Holmberg ran us through an exercise as an entire class full of clinicians learning about this technique. And I'll be honest, it was life-changing for me, practice changing, and how I approach with my patients. And I haven't gone back since. So I'm really, really excited to hear more about this and get more people on board with what we're talking about.
Well, I love what you say, and I love that it's in that training. Now, I did training with Susan Herdman and those before it was at Emory. It was at Miami, and this was 20 plus years ago. But I think that certainly clinicians are being trained about it, and that's very, very helpful. If you've ever done this work, put in the comments and let us know, if you've done any of this with your vestibular rehab program. I'm interested to hear. But like I said, in the olden days or in the earlier days, people were missing out on this. And I think it was something their patients were missing out on. Just to reiterate what you're saying, there is strong evidence for the support of using the somatosensory system or proprioceptive system as one of the three main sensory systems that are required for equilibrium. So I love your picture behind you, Danielle. I wish I had that picture. Yeah, that's your vestibular system, and then your visual system, and then your proprioceptive or somatosensory systems. Those are what give us equilibrium. They make us feel stable, and they help us discern whether we're moving or whether the room is moving or whether the car beside us is moving or what is happening. So in the research, we understand that many patients, probably most patients with vestibular symptoms, tend to be over-dependent on vision and a little inattentive of that proprioceptive feeling. So if you've ever done the foam and dome test, we used to call it, or the clinical test for sensory organization and balance, if your therapist has had you stand on a foam surface or put goggles on your face, or even been in a high-tech smart balance master or Equitest system, there's a number of different systems. I know I age myself when I say the words because I bring up the original ones. But anyway, if you've done that high-tech or low-tech, you know that your therapist has tried to piece apart whether you are depending too much on vision or whether you need to orient to your proprioception. So today, that's what we're talking about. And I hope that's a good introduction to why it's important, why it's actually essential. And while it sort of sounds like a complementary and alternative approach, because we're talking about breath and relaxation, it really is one of those integral parts of a comprehensive vestibular rehab program. In my practice, it's something I touch on the first session. Why? Because sometimes vestibular rehab exercises can increase your symptoms of dizziness and vertigo and whatever that is. So it's important that you teach the nervous system how to calm itself down and how to recover so that any training you do will be more effective. I use a form called a Symptom Questionnaire, and I want to share that with y'all now on the screen. Take a look at this Symptom Questionnaire. And it's also, let's see, did we have it in the comment section with the link as well?
Let's see.
Yes, right? It's at the very top. That, I think, is the link to it, right? Is it in the comments? Well, anyway, if you look at this, what I want you to do is read these words. You'll notice the word dizzy isn't on here. So when a patient comes in and says, I'm dizzy and I want help for that, I say, tell me how you feel without saying that word. And I know you've all heard this before. We say that a lot. Therapists make you change your words. Go through these words, and I want you to put a check mark by each word that you feel relates to how you feel when you're having symptoms. These words are a variety of words. If you don't know what one of them means, just skip it. There's probably another word or a group of words that describe you more. Words like reeling, undulating, pain, dazed, sick, heavy-headed, listing, fuzzy-headed, staggering, drunk, scared. So again, go through each one of these and count how many words describe your sensations of what you call dizziness. And then I want to know what your number is before the session today, and then we'll check your number again after, at the end of the session. Okay? So it goes on with whirling and lightheaded. Notice it's lightheaded and it's heavy-headed. People have different sensations. I'll give you a minute to take a look at this.
The thing I like about your sheet here, Kathleen, is sometimes people have a really difficult time putting words to how they feel. And I think having a checklist like this, of the various common things that we hear, might be able to help somebody put words to how they're feeling. They might look at something and say, I can relate to that, and be able to check off and start to feel like they have a good idea of what they're feeling, what they're experiencing. I think this is a great tool to use as a clinician.
Thank you. It even helps me as a clinician know if I need to think about blood pressure or other things that may be non-vestibular causes of dizziness. So certainly there are words on there that you might say, that doesn't really sound vestibular. Well, you're right. It's a screening tool, and it is looking at that. If you're dizzy and you have pain, what's the pain related to? If you're feeling a rush, what is happening there? So certainly the anxiety, as you said before, I just wanted to touch on, is a normal reaction to feeling this way. So I want people who struggle from vertigo and dizziness, whether it's sudden or acute, or whether it's new to you, or whether it happens unexpectedly in a chronic nature, like over years with some of the vestibular diseases, this is a normal physiological response of the nervous system to feel afraid and to feel anxious. So you need as many tools as you can to try to manage these symptoms. So let us know in the comments if you've finished your number, and I'd love to hear how many words.
We're getting a couple of scores rolling in. We've got Gabe, who puts himself at a 37, and Carolyn, who's at a 22, and we've got someone who's clocking in at 26. And could you maybe define what giddy is? Somebody's asking, what might that be? We know we see that on the diagnosis code all the time, right?
I know. Dizziness and giddiness. It was the diagnosis code before the vestibular codes were added. So it used to be the only thing we had to choose from, almost. Now, I think someone's here from the United Kingdom, so maybe they know what giddy is. I always think it's an English word, but I don't know. It's just dizziness and giddiness was one of those things. I think it was on the diagnostic code when they had the word hysteria as another thing that women had when they had hysteria. I don't know.
Yeah. So we can share this form later, right? So if this isn't in the chat like we thought it initially was, we'll be sure to go back through the comments and share the link to this form so that you guys can fill it out at home. This is a great thing to be able to know where your baseline is before and after you try these techniques or go through therapy. So we've got a pretty wide range. We've got some people as low as 7, all the way up to 38. So it sounds like we've got a lot of people tuning in who are pretty symptomatic, Kathleen.
Good. Well, not good for you, bad for you, but good for this example. And my hope is that we have a shared consciousness tonight, and that together we send positive energy and experience to the whole, so that while doing this together, we may all collectively feel more grounded and connected. So this is one number that I want you to know, but I also want to ask you another general term. Oh, how do you score it? Not 3 points each, Katerina, but 1 point for each word you selected. So just give me a number for how many words you related to as your symptoms. And it doesn't have to be right now, and it doesn't have to be all the time. Some of these are sometimes words. So you just give yourself a number. Now, when we get in the present moment and we're mindful about right now, I want you to think about how bad are your symptoms as a whole right now. And you can take that sheet down, I think, unless anyone needs more time. Okay, let us know if you need more time looking at that. Thanks. So as a whole, on a 0 to 5 scale, let's see, I should do it this way. Which way do I do it?
There we go.
this way. On a 0 to 5 scale, how dizzy are you right now? How bad are your symptoms at this moment? Again, give me a number on a 0 to 5 scale.
And what would 5 be, Kathleen? Can you give me an
5
example?
would be the worst you can imagine. Like, I need to throw up. I need to go to the emergency room. I need to get out of this class, lay down, do something drastic. So on a 0 to 5 scale, 0 is no dizziness and 5 is the worst you can imagine. And for some people, at least a lot of my clients, it's that very first episode when their symptoms come on so bad and maybe they throw up and they end up on the floor and they crawl to the bathroom. And so that's often the very, very worst thing. Well, I'm happy to hear that some people are managed well today and 0. Only when standing with triple PD, that's good. Excellent. Good. I love that you guys are participating. This is so good. This will help you all. So now that you've given your baseline symptom scale on that with the words, and you've given yourself a number on 0 to 5, I want you to find yourself in a comfortable chair. Okay. So try to sit back in the chair. If you can't sit all the way back in the chair, bring the back of the chair to you by putting a pillow in the back of the chair. I want your back against the chair and I want your feet on the floor. Again, if you can't reach the floor with your feet, scoot forward and put a pillow behind you or bring the floor up to you by putting your feet on a box or something. I used to say a yellow pages, but I don't even have phone books anymore. Okay, so put your feet on something because you want to feel supported. So let's begin now. I want to put on the screen the words I'm going to use so that those who may have trouble hearing me can read this. And you don't have to read along. If you want to, just listen. We'll begin now with breathing, relaxing, and feeling. Feeling gravity pulling you straight down into the chair. Tell yourself you're steady and not moving. As you exhale, feel your head and your posture aligned with gravity. Feel your head over your shoulders. That might mean that you adjust the position of your head. And if you want to know, how do I know where my head goes? As you're sitting upright in the chair, I would ask you to put your hand on your head and imagine a string pulling you up. Pull a few strands of hair up. That will help you elongate and feel your head aligned over your shoulders, over your hips, over your pelvis. I like to close my eyes. If closing your eyes bothers you, you can instead focus with eyes open on something in front of you that's not moving. Again, breathing, relaxing, and feeling gravity pulling you straight down into the chair. Tell yourself you're steady and not moving. Align your head over your shoulders, over your hips, and feel the heaviness of gravity pulling you down through your pelvis. Imagine you're sinking down into the chair. You are grounded and connected. As you focus on breath, take one hand and put it on your head. Gently press down with just the weight of your hand on your head. Again, make sure your head is focused straight ahead and that your ears are still over your shoulders, over your hips. By pushing down on your head, you are awakening the sensation in your neck muscles and your neck joints that tell you your head is steady on your shoulders. Breathe, relax, and feel again as you exhale. Feel your head aligned over your shoulders, over your hips. Feel gravity pulling you straight down. Let's stick to concentrating on the head for a moment. You can see me here if you need to. I'm going to show you. If you tilt your head one side, see if you can feel what it feels like to have your head tilted a little bit to the right. Do you feel that? If you do, tilt it now to the left. Can you feel that it's tilted left? And then take it to the center. And memorize what it feels like to have your head in the center, or actually vertical, oriented with gravity. That's the center place where your head belongs. In this place, if you lighten your hand and move your hand away, when your head is lined up over your shoulders and in the center, it stays there with less muscle energy to hold it there. If your head goes forward, you'll feel the tension that builds in the back of your neck and the fatigue that will ensue if your head is tilted forward. But bringing your head back to center, aligning with gravity, ears over shoulders, over hips. Again, hand on your head if you need it, with gently pressing down, will help your body learn and understand where the head belongs. When we're in equilibrium, we are most efficient. That means it doesn't take a lot of muscular strength or energy to hold us in balance. And we can relax and breathe. So with the head in that new neutral position, let's focus now on feeling your back in the chair. If you have a straight spine instead of scoliosis or something like that, your shoulders should be touching and your rib cage should be touching the back of the chair equally, left and right. Check for rotation of your spine, and if you want to, again, rotate your shoulders or your trunk to feel what is the center place where I'm aligned in the chair straight, with my head over my shoulders, shoulders over hips. Let's go now to the pelvis. If you think about your pelvis, you have sit bones down there. See if you can feel those sit bones in the chair, in your pelvis, and whether it's equal between right or left. Well, how do you know if it's equal? Shift to the right. See if you can feel when you're shifted right that really is heavier on your right side. With your eyes closed, can you feel that your body is tilted to the right? Shift back to the center, or what you perceive as the center. Shift a little bit to the left. See if you can feel that you're heavy on the left hip, and then go back to the center. The center should feel at home. Sometimes in therapy, your therapist might say, you need to shift yourself more to one side or the other. Sometimes I tell my patient, upright for you is 5 pounds heavy on the left. And then I teach them to memorize what that is. But when you have your eyes closed, sometimes if you have a vestibular lesion on one side, it causes you to be off this vertical place. So I want you to ignore your vestibular system for this moment and focus just on what the pressure feels like. The balance of your head on your shoulders, your back in the chair, and your pelvis in the seat. The pressure you feel is not going to lie or confuse you like your inner ear might. And as I said, we have to learn to bias or give higher value to the pressure in our body and the body sensation that tells us we're steady, we're in equilibrium, and most importantly, that we're not moving. Continuing the exhale. Deep cleansing inhale and exhale, sinking down into the chair. In equilibrium, we are most efficient and relaxed, with ears over shoulders, over hips. Feet are on the floor, they're flat on the floor. Feet flat on the floor. I'm going to open my eyes and look at the comments a little bit and see how people are doing. Internet isn't working well. Sitting and not moving too much, I'm at a 3. I'll try again later, giving me a headache, neck ache, and stabbing in the ears. I'm so sorry to hear about that. That's interesting. I want to continue to address any difficulties people are having right now as they're trying to breathe, relax, and feel. If you're having trouble grounding, let me know in the comments, because I want to show you how I would help you progress through the technique depending on your particular symptom.
Okay.
For the one who has pain in the head, I would probably try with 2 hands instead of 1 hand down. Hold hands on the face or on the forehead this way. So if you have head pain, you can use your hands on a variety of points. If your head hurts here, you can use pressure points here and here. You can put hands on both head. You shouldn't be pushing down hard.
Now, Kathleen, is this something that maybe we can modify the position for those who maybe have a lot of neck pain or they need more somatosensory input? Could they change their position in any way?
Yes. So if you have, good, feels very relaxing to me, almost like when I meditate. That's what I'm looking for, but I want to address those of you who are having trouble, okay? So if you feel that your neck is too weak to align, you could put your hands here, but I want to make sure that your muscles aren't working overtime. That's why I want you to find this place. Now, if your neck is hurting or your head is hurting because you've put yourself in alignment and you're not used to it, then allow yourself to be here. If this is where you usually live, allow yourself to be here and try the technique. If you need support, you can rest your head on your hands here. I use a pillow in the lap, and this is what I wanted to show you guys who might be having trouble. With a pillow in your lap, rest your arms and stabilize your head. Because for some, ears over shoulders is too much. So keep working with me to try that alternative place. Another thing, if you can get your head aligned, but it's just still hurting, you can put yourself with your chair against the wall, or you could be in a taller chair where you have, your head against the wall so that you feel support through your head and your neck.
What about when people are starting to experience different sensations? So we have somebody that maybe has more anxiety through grounding, or they get a jolt of lightheadedness, which kind of scares them a little bit out of that grounding state. What would you do for that?
So one of the things I want you to do is listen to your body. This is an intense body exercise, so we welcome whatever your body is telling you. You are the master of your body, and you have it within you the power and the interest to pay attention more than anyone ever has. So be curious. What do I feel? Curious about lightheaded. Where is that? What makes it better? What makes it worse? Yes, I like relaxing the shoulders, let them drop down naturally. Of course, that's true. Let me keep looking at these. So the anxiety, if you're afraid when your eyes are closed, open them and focus. If you're afraid because you're still, then move a little bit and then stop moving. If you feel like you're floating, then you're the perfect one for this, because you need to orient to the surface of your chair. So you might need a harder chair, one where you really feel like your bones of your buttocks or the pelvis are touching the floor or the bottom of the chair. So you don't want to be on too squishy of a surface, because the goal is we're trying to get rid of that floating feeling. I want your head to feel connected to your body, for you to feel connected to the chair. So I want to look more at these symptoms. Doesn't feel confident in areas such as feet and pelvis. If you're having trouble, and a lot of people have a disconnect of energy, that sort of their energy up here with their symptoms is where most of the things are going on, and they can't find, well, I don't want to sound strange, but they have trouble finding their body below their pelvis. So in those cases, if that's you, I would even suggest that you put yourself in a lying down position to begin grounding. Now, I do work and energy work with people to connect their feet to their head, to connect the pelvis in between, because all of that needs to connect top to bottom. But again, be curious about what you're feeling. If you feel like I can't connect with my hips or I can't connect with the floor, think about where that block is. What can you feel? Can you feel this? And again, if you say, yes, I feel my neck and it hurts, then think about, what if I tense my neck and then release it? I tense it and release it. You can press and release, press and release, press and release. Sometimes isometric contractions of muscles are followed by relaxation of those muscles. And that's physiologically sound advice too, to say, I'm going to contract and then relax. So for those of you who feel, and I do find the most of my vestibular patients, many of them have a very weak anterior neck. Again, because posture and COVID has put us in this position so much that the neck on the front is weak and the back of the neck is working overtime. If that's true, it may be that you need some isometric cervical stabilization exercises, contracting and relaxing and strengthening the front of the neck. But for now, allow yourself to support the front of your.
Joy brings up a very good point, and something that I wanted to mention. This is not something that you're going to master in 10 minutes. This is something that you need to practice and utilize on a consistent basis to start to feel comfortable with it and start to get better at it. I actually use these techniques myself when I'm feeling symptomatic with migraine, or if I have anxiety and trouble sleeping. And it took a bit to get to the point where I felt comfortable and confident with it. So it's not something that you're going to learn right away, but to continue practicing and feeling how comfortable you are with it, it'll get better and better over time.
So true. And what I really like about this is what you want to do in this is be mindful. The word is mindfulness now. Everybody says that. I used to just say, be present with yourself in this experience, with curiosity about what your body's telling you, without judgment about what your body's telling you. So say, okay, instead of saying, I feel afraid or I feel anxious, say, I feel my chest tightening. What is the body feeling rather than the emotion? What is the body telling you rather than analyzing what you think that means? Okay, so like a floating. So I would say then focus on this, and then you might need some more, neck exercise to help your neck muscles. I tell people the neck muscles, all the muscles have springs in them that tell us where they are. Are they strong? Are they tight? Are they stable? And those sometimes need a little updating and work on the muscles, so the muscles feel supportive and can structurally support your head on top of your neck. So I integrate that into the program. But develop this curiosity about your body and what it's telling you without judgment and without analysis. So again, is it, you have pain? Does it feel like fatigue? Is it a trigger point pain? Is it fear and anxiety? But what does that do in your body? So I want you to get into your body and really think, well, what do I feel? And what can I do to care for that very, very specific symptom? How would I soothe that specific symptom? And if it feels like my chest is tight, I feel, this, then take a nice deep breath again and inhale slower and exhale slower. I practice slowing my breath so much that I can breathe 1 or 2 times in a minute, So, you can really, really control and lower your energy waves and your frequency and your breath. And the other thing about the chest is make sure that you're not just chest breathing. If you recall ever having learned diaphragmatic breathing, you know that you can inhale through your diaphragm coming from down here instead of any breath coming up here. And when you breathe in, you push out the diaphragm, and as you exhale, your diaphragm goes in. So what that looks like is breathing in and breathing out. Breathing in and breathing out. That will often lower that chest tightness and anxiety that comes in the chest. Okay, so diaphragmatic.
We have a couple of actually really great questions that I can kind of stitch together. What about progression? We have someone asking if you can do this standing up, if you'd recommend that. And also somebody it looks like you spoke to earlier today wants to know if there's any benefit to grounding that can be extended to walking and moving around.
Absolutely. Well, I love that. Thank you for joining me. I sent a patient, yes, I talked to Justin earlier today, haven't seen him, but sent him to this video because like you and I were talking about, people will have a better opportunity to respond to vestibular rehab if they have some body awareness, I think, and if they can understand their symptoms with curiosity, describe them in terms of how your body feels, and then we can help you find ways to soothe those symptoms. So there's absolutely a progression. So let's go on to this. So the first thing I want people to feel is to learn to feel stillness. So if you're one of those people who feels like you're moving all the time, I want you to learn to feel stillness. I call that finding zero. On that 0 to 5 scale, if you were a 3, I want to know if you could find 0 in this exercise. If you found 0 in this exercise, please let me know in the comments. That's finding 0. In this position, if you couldn't find 0, you want to find it in lying down, okay? So if you need more support, go to lying down. I'm going backwards, but I will talk about the progression, I promise. So you're going to try finding 0. Once you've found 0, know that that is where your body feels most in control and has that internal certainty about stillness versus movement, about safety and control. And that's what we're trying to find, okay? Finding 0. So often I start in sitting like I did with you all today, because this doesn't maybe work for everyone, but this works for most people, starting in sitting. From here, I teach people to move into standing. Now, one of the early exercises I give people anyway is to practice moving from sitting to standing with their eyes closed. And practice in standing balance. You want to feel, breathe, relax, and feel your feet in contact with the floor. Maybe you've done this before in balance exercises where you're asked to feel the pressure in your feet and feel whether you have pressure on your toes or your heel or your left foot or your right foot. That is surface orientation and grounding also in the form of a balance exercise. So absolutely, absolutely yes. I love this. I found 0, find 0. It is exciting. It is to be celebrated because you want to find it in lying, sitting, standing, moving, and you want to find it when walking and moving your head. That's the progression you want. Exactly. So once from sitting, you can find 0. Work on finding it in standing. Okay, standing steady. It's normal to sway a little bit in standing, particularly when you close your eyes. Everyone does, but you still need to understand, where am I swaying? Am I swaying equally forward and back? You shouldn't sway much right to left, but a little bit of normal sway might be around that center place. So I teach people, where's that center place when they're standing? Equal pressure on right and left foot, equal pressure on heels and toes. Once you get to where you can feel the floor in standing, and here's another tip, then you'll be able to apply that awareness to all activities throughout the day. Okay, so back to standing. Practicing finding your feet can be quite difficult for those people who just don't feel connected to the ground in standing. One of the best things to do is to practice moving from sitting to standing with your eyes closed. If you're safe and you feel like you can do that, once you close your eyes and you move from sit to stand, you'll immediately start waking up your feet sensors. Now, that's for most people. Beyond that, there's a lot of other techniques I have for waking up the pressure and sensation in your feet. Even for people with peripheral neuropathy, you can feel more in your feet, even if you have an abnormal EMG. Would you agree with that, Dr. Tolman?
Yeah, absolutely. This is not something, if you have peripheral neuropathy, it doesn't mean that all hope is lost.
It doesn't mean that. And so even if the doctor says, well, I have peripheral neuropathy, so I'm not going to be able to feel my feet. Yes, your brain is amazing. There's something we can find in there. And I have a variety of tools, for another day to talk about how to awaken those sensors in your feet. I love this. So 0 and 0 and 0 with laying down.
I want to know, everybody, if you answered where you were on your 0 to 5 scale before we did the grounding technique. I want you to comment again with where you are now. Are you the same? Is it any better? Did your symptoms decrease as we walked you through the exercise and we were finding ways to kind of find our 0? Where are you now? Put those in the comments if you don't mind. I'd love to see where you are after just a couple of minutes of listening to Dr. Stross.
And I really do want to hear if you're having problems. So you're not going to offend me or upset me. I want to know who's having trouble, because if you're having, there was someone with was there someone with lightning or sharp shooting pain?
In the ear, yeah.
So, even for that, there's a lot of things. I would grab the ear around the back of the ear like this, and I would even do probably a myofascial pull around the ear, and I would start going there to comfort that place. So a lot of nerves and awareness of the nervous system come to play when you're quieting your body like this. So these are just noises that I want you to be curious about, and I want us to work towards comforting. So touch the place that feels strange, pull on it, tap it, move it, rub it, press it. You want to know some extra tricks? Even in your mind, you can put ice on it. I know that sounds crazy, but you can, in your mind, put ice on your ears, put ice on your temple, cool it down. Or if people say, no, I hate cold, warm it up. Sometimes the imagery combined with the grounding is the magic sauce. Okay, so sometimes it's seeing blood flow to that area to clean it out. See your neck ripe with healthy blood flow and nourishment. So we use our body and all of our senses to bring us to stillness and wellness and wholeness.
Now, Kathleen, I think one thing, this has been fantastic listening to you walking us through, and unfortunately we can't all pack you up and bring you home with us. Is there any way that people might have a difficult time doing this on their own? Is there anything that they can tap into, like a resource like YouTube or meditation app, something that they can start to practice with to get them to start to feel this?
Well, of course, I like to think that my voice is going to help you through your symptoms. And if you want to, you go to my YouTube channel And I think I made an overlay that might have that on YouTube, or you can go search my name on YouTube. And I have a couple of grounding videos and techniques there. One is short, and I talk you through it. And with repetition, you start to take the script that I have and adapt it to yourself and have that repetitive conversation with your body. So if you go to YouTube and you search Kathleen Stross, you should find my YouTube channel, and there's a couple of different grounding offerings there, and I want you to use those. And certainly, I told people I give free consultations. You can email me, you can call, leave a message. I will talk to you about how to help you progress your symptoms. If this is something you need more help with, then a few telehealth sessions, because this is health and wellness, would help you as well. But I want you to, celebrate the fact that you participated today. Go back to that symptom questionnaire, look at how many words you circled in, and if any of them responded. And if some of them didn't, let's look at and think about what else can we do to help with that. But I want to know what questions you have, and let's see, and then just invite you to practice becoming more aware of grounding, more aware of the surface, because even moving into walking steadier, this awareness of pressure sensation in your feet will greatly enhance your ability to walk and turn your head, or walk and turn around, or walk and stop and turn, and all those things. I'm imagining that if you've had any vestibular therapy, you know that I have people walk and stop and close their eyes and walk and turn around and all these things. Orienting to the ground every time you walk and stop and orient to the ground. That'll really help you plug into the earth, plug into the grounding, and help you manage your symptoms. I think that an enhanced body awareness is one of the key management strategies for calming the nervous system and decreasing the chaos that the vestibular system can cause, regardless of the vestibular diagnosis. Again, this is helpful for people with acute problems and chronic problems, whether it be triple PD, migraine, Meniere's, it doesn't matter. This is independent of diagnosis. And it even is quite helpful and essential for people with vestibular loss, because you have to orient to what you feel.
Well, this is perfect timing with the holidays coming up. Traveling with vestibular dysfunction can be very stressful. It can be very symptom provoking, especially when we're off our usual diet, our usual sleep routines. This time of year is the perfect time to start utilizing this type of technique to help minimize all those symptoms that might come up. I also want to include your website here at the bottom, where people can find you even after this live portion is done. But this has actually been fantastic. I think we've had a great response from people who were following along with us. If you guys have any more questions, please put them in the chat so that we can make sure we hit them before we wrap up here.
Yeah. Well, I can address this question about visual stimuli. The goal is, or let me just explain, visual movement or movement in the visual surround is not typically distracting or disorienting or symptom provoking for most individuals. When visual stimuli is provoking symptoms, it's because your brain is overly sensitive and overly dependent on vision to check in about itself, as if something moving has anything to do with me. When you can practice grounding and feel connected to the surface and let the pressure sensation, even my hands flat on this table, telling me that I'm not moving back and forth on the table because my hands are relaxed here, tells me through my body that I'm not moving. So when you find zero, then I ask people to begin finding and maintaining zero in sitting and allowing things to move around them. Maybe you would begin doing it and looking out the window, and you'd see cars passing you. Can you continue to stay grounded in your butt, in your pelvis, in the chair while you see cars passing or kids playing or the TV moving? So you can progress yourself, because you have to tell your brain that what's moving out there has nothing to do with me. I'm grounded and connected, even though that's moving. Now, in session with me, if I was in a telehealth session, I might have you ground and connect and work, and I see your face and I start doing this, or I start moving around and people go, oh, stop, right? But you have to stay grounded and connected through your body, because that's your internal gauge. External stimuli will not have an impact on you once you can get this. So it is part of the process. I know that visual stimuli is very disruptive to people and throws them off. It's why this is necessary. And you know what? There's no pill, there's no surgery, there's no magic sauce to get the brain to adapt to that visual hypersensitivity. You have to be able to feel steady in your body, and your brain has to know that you're not moving and you're safe, and that you can see things moving, that they don't have anything to do with you. You just have to say, that has nothing to do with me. I'm still upright. I'm still steady. So I hope that helps. But the fact that you're telling me that, visual stimuli is disruptive is exactly, the kind of people with the kind of symptoms that need it. I love this. Finding zero. James talks about being at a holiday party. I have all these, it's exactly what I talk about when I train people in therapy for being in social situations. Walking in the room one step at a time, feet and feet and feet, and see yourself walking into that room with your feet planting, looking at the room full of people, and standing, breathing, relaxing, and feeling, and grounding yourself to the floor, even though all the people are moving. Grounding through the floor, through your feet, selecting the place you want to sit at that holiday party where you're not having to see everything. Face the wall. You want to be facing the wall to minimize that visual stimulation. You want to pick a chair that has a firm surface and that your feet touch the floor, because you want to stay grounded and connected. But you're right, each time you get up to move, feet and feet and feet and feet, and connect. Or walk next to something that you put your hands on, and you just put your hands here. I'm grounded and connected and I'm steady, and you can open your feet and stand there with your hands on the bar or the table. You should be mindful of being grounded and connected in your social situations, and it'll really help you. And if you have to go to the other room, sit, put your hand on your head, or stand and put your hand on your head, and really go through the breathe, relax, and feel technique. Those words up one more time for those still hanging on. These words that breathe, relax, and feel, feeling gravity pulling you straight down. That's the mantra I want you to memorize in your mind, that you will take yourself through in those times when everything around you is moving, but you're needing to find stillness. What else?
This is. It looks like everybody has so many great things to say. It sounds like that this has been a big help and a pretty good success for our first workshop series. This is something that involving our patient population and caregivers and anybody else involved with vestibular dysfunction, I think, is a great thing to do to kind of get people feeling better sooner. So we have KathleenStross.com of where people can find you. We've included a link in the comments about where they can find your YouTube videos for a bunch of really helpful talks like vestibular exercises and grounding exercises. It's definitely a lot. It's more recommended to get with a provider who can accurately diagnose you and help you through your treatment and your journey back to balance. But also remember us over at vestibular.org. Our programming is something that we are bringing to you with out of the goodness of a lot of our clinicians' hearts and people on the board like us. There's a lot of work that goes on behind the scenes, especially with Giving Tuesday coming up. Think of us maybe as an organization that you can donate to. You know, your donations go a long way to help programming like this continue and continue to bring more resources to you guys. So please also leave suggestions in the comments if there's anything that you want to hear about, if there's anything that you want to learn, if there's something that you want us to touch on in one of these workshops. Please let us know. Keep the comments rolling. You know, even after the video is live, we'll be back to check on some things and answer as needed. And Kathleen, thank you so much. Can you give me any more about where we can find you? Is there anything else I left out?
No, I think you've covered it. I'm a provider in the directory at vestibular.org. Please go to vestibular.org. Use the resources we have developed there for you. And we are always welcoming volunteers to help us reach more people. And, I just care about this organization and every vestibular warrior out there across the globe. And we just appreciate and need your continued support and spread the word about what we're doing. If you haven't already and you're feeling alone, make sure you go look at the Life Rebalance Chronicle series. It's still out there and available. I'm still so excited and proud to share that. So, this isn't about me. This is about getting people to feel settled, feel better, feel good again, which is, my sort of slogan, and having a great time through this spin cycle of the year. I once heard it was called the spin cycle of the year, like the washing machine, but for the vestibular warriors, spin cycle is really a traumatic word. So.
Absolutely. No, we hope that this was helpful to all of you. Please utilize these techniques moving forward, especially going into the crazy chaos of the holidays. Let us know how it goes, and don't be afraid to reach out if you guys have any more questions or comments. Thank you so much for joining us all tonight. And Kathleen, thank you so much. This was absolutely fantastic. We really appreciate it.
Thanks for the opportunity. Can't wait to see y'all again next time. And I think the next workshop we'll be doing will be with Dr. Tallman, right?
Yes, it will.
Do we have a topic yet as a teaser?
Well, I don't know if you saw this. So I have a YouTube video that I put together at the beginning of COVID last year, just for something to help my patients. And it recently hit 1 million views for how to perform home repositioning maneuvers for BPPV. So I'm hoping what I can do is for our next workshop, come to you live from my bedroom and show you how you guys can do repositioning maneuvers at home safely and confidently as a way to maybe self-treat if needed. So there's a lot to talk about there. So we'll see.
All right. Well, thank you all so much. It was a pleasure, and remain in harmony and in balance, and all the best to you all. Thank you for the opportunity.
Good night,
See you
guys.
next time.
Go to vestibular.org for more videos like this one. Also there, you'll find information, support, and encouragement to help you find your journey back to balance.